Speaker recognizes Representative Sowerby.
Thank you, Madam Speaker. Today I rise to oppose House Bill 5637 that would endanger patients and give physicians a free pass to circumvent safety precautions, ignore reporting requirements, and make decisions with no accountability whatsoever. This legislation, Madam Speaker, would allow any physician to use any drug or device for any reason other than the FDA-approved usage without being subject to state medical board review, hospital rules and regulations, and medical staff quality assurance programs. This bill, as it stands before us today, would create an unregulated pathway to administer investigational or unapproved drugs without any oversight or reporting responsibilities. To properly use an investigational drug or device, a protocol is submitted to the Federal Food and Drug Administration. This is important. Again, the protocol is to submit to the FDA for this investigational drug or device for its approval. The investigators must be certified in human subject rights protection, and the informed consent forms are carefully crafted to ensure they meet legal requirements and preserve the test subject's rights without coercion. Furthermore, these trials must collect and submit their data to the FDA, and the entirety of the trial must be approved by institutional review board of the hospital or facility in which it takes place within. Now, these are all guardrails that exist for a reason, Madam Speaker. They exist to protect the safety and rights of the patient, ensure that the data collected, whether promising or unfavorable, is complete, untainted, and scientifically sound. Guardrails, which this bill will get rid of as it relates to COVID-19. Were a doctor to have 100 patients, again, I'll say that, were a doctor to have 100 patients whose conditions measurably worsen after administering an unapproved drug, not one aspect of this bill would require the doctor to report that. Just one miraculous survival attributed to that unknown drug could drastically impact the public's perception of its efficacy, despite no requirement on the treating physician's part to provide information on how it fared for other patients or what adverse effects occurred. Physicians would be free to trial any drug or device on desperate patients with zero evidence that the drug or treatment may help, and would be free from all restrictions or oversight while doing so. Hospitals would be unable to sanction inappropriate activities of their medical staff, and the state medical board would be prevented from acting against a physician for grossly inappropriate usage of a drug or treatment. These guardrails, Madam Speaker, are vital and were spurred by terrible instances of abuse by medical professionals in the past, such as the appalling Tuskegee Airmen incident. Removing this regulation as it pertains to COVID-19 patients and allowing any drug, any device, or any treatment under any stage of investigation by clinical trial, as well as any drug currently used to treat any other illness, only opens the door to more abuse to occur in the future. Put simply, this bill provides a pathway for unscrupulous physicians to act without oversight and treat patients as test subjects. And for that reason, I stand firmly opposed and urge you all to oppose House Bill 5637. Thank you, Madam Speaker.